Today I'm going to talk a little bit about post-anesthesia recovery. So what is post-anesthesia recovery? So guys, this is the destination or where surgical patients go to wake up after receiving anesthesia. We call this area the PACU or post-anesthesia care unit, and the PACU RN is going to be the one providing the care. So what are the sequence of events that occur in the PACU? So guys, I just want to mention that things can occur slightly different than this list, as all facilities run a little bit different, but this will give you a good idea of what occurs. So after surgery, the surgical patient is going to come into the PACU from the OR and will be met by the PACU RN, who will provide an immediate admission assessment. A handoff from the anesthesia provider and the perioperative RN will give information to the PACU RN. A more thorough assessment will be completed along with implementation of interventions and an evaluation to prepare the patient for discharge. Okay, so let's take a closer look at the steps. So when the patient arrives and is immediately admitted to the PACU, the RN will perform an initial assessment that includes the ABCs, or airway confirming patency, breathing, which would include applying oxygen and a pulse oximeter, and circulation by connecting the patient to a cardiac monitor to evaluate the heart rate, rhythm, and blood pressure. So once the patient has arrived and an immediate assessment by the PACU RN is completed, the handoff report will take place. The anesthesia provider will give any important information about the patient and the surgery. This can include information like the anesthesia type, the ASA classification, or basically how sick the patient is, the anesthesia medications given, fluids, lines, and estimated blood loss, or EBL. The handoff report from the perioperative RN will give the PACU RN slightly different information. This information can include the diagnosis, the procedure performed, any complications, location of drains, dressings, incision site, any medications given by the surgeon during the procedure, as well as any specific patient information that needs to be provided. And it is very important to mention that the handoff of the patient is never complete until the PACU RN assumes responsibility of the patient. All right, guys, so after the handoff, the PACU RN is going to complete a thorough initial assessment. This is typically specific to the surgery that the patient has had. So guys, there are quite a few things that the PACU RN assesses in their patient to determine their safety in the moments just after surgery. So let's go through this list. Of course, the vital signs are going to be continued to be assessed, which includes the respiratory status of the patient, confirming airway, breath sounds, or even artificial airway settings if the patient is on a vent. Also, the patient's blood pressure, heart rate will be assessed by cuff or even arterial line for the blood pressure. Temperature is very important to assess in surgical patients, as they are very prone to perioperative hypothermia. Guys, be sure to check out the lesson on intraoperative complications for more information. Continuing on, assessing pain, sedation level, and comfort are all included in the initial assessment. Also, guys, the condition and color of the skin will be considered. A neurovascular check will be completed, especially if the surgery occurred on an extremity, which will include pulses and sensation of the extremity. Also, it's important for the PACU RN to verify the condition of the dressings, the suture line, drains, as this could really indicate a serious issue if the drains are draining too much or the dressings are becoming quickly saturated. Guys, be sure to check out our lesson on post-operative complications. Okay, continuing with the initial assessment, the muscular response of surgical patients is also important to indicate any issues, and also the pupillary response and the post-anesthesia score, which can help to indicate if the patient is still sedated and how ready the patient is for discharge. There are different scoring systems for this, but a super common one is the Aldrete score. So the Aldrete score, like I mentioned, is a scoring system that evaluates how ready a patient is to go home safely. So based on a few different categories like consciousness, mobility, color, breathing, and circulation, the patient will receive a score from 0 being the lowest and the worst to 10, and 8 or 10 being the necessary score needed for discharge. So just remember, 8 is great. Also, guys, we always want to monitor the intake and output of the patient, as this could indicate an issue like dehydration. So what happens after the patient receives a very thorough assessment by the PACU-RN? Well, of course, the RN is going to continue monitoring the patient closely, but they are also going to begin promoting interventions like deep breathing, oxygen delivery that can eventually be decreased, mobilization, and pain management. So guys, the hospital where I work is super quick with some of the patients being discharged within an hour. So as you can imagine, the PACU-RN must be very efficient and focused in the care of their patients. So finally, guys, the PACU-RN will evaluate the patient to assess their readiness for discharge. We want to see the patient exhibit adequate ventilation, adequate BP, heart rate, and a tolerable pain level. We also, at this point, want to make sure that pharmacologic and non-pharmacologic interventions have been initiated, and we want to be sure that the patient is starting to gain an understanding of discharge instructions. And don't forget about any postoperative orders from the provider. So after a patient receives anesthesia, they can be sleepy or even a little out of it in recovery. So with that in mind, sometimes teaching is difficult until they wake up a bit, but always try your best to teach and encourage patients to express their pain and comfort needs, and of course, ask questions. So when we consider nursing concepts that apply to the topic of post-anesthesia recovery, safety is the first to come to mind. Oxygenation is huge, as our surgical patients have just emerged from anesthesia, and of course, comfort is one of our keys. Okay, guys, let's look at some key points. Post-anesthesia recovery is the destination of anesthetized patients where they wake up after surgery. This occurs in the post-anesthesia care unit, and care is provided by the PACU-RN. The anesthesia provider and perioperative RN will provide information regarding the surgery, like anesthesia type, procedure performed, lines, drains, incision site, complications. After the handoff, an initial assessment is performed that is usually specific to the surgery, but includes vital signs, pain, sedation, comfort, muscular and neurovascular check, and post-anesthesia score, or also known as the Aldrete score. The PACU-RN implements interventions while still monitoring the patient with deep breathing, mobilization, and comfort interventions. The end goal is discharging the patient, so evaluation is necessary to be sure the patient is adequately ventilating, they have good vital signs, and a tolerable pain level. Okay, guys, I hope you enjoyed this lesson on post-anesthesia recovery. Make sure you check out all the resources attached to this lesson, as well as the rest of the lessons in this course. Now go out and be your best self today, and as always, happy nursing.